By this time tomorrow morning, South Africans will wake up to level 2 of the coronavirus lockdown. The unbanning of alcohol and tobacco sales has been welcomed by many. There have been mixed reactions from political parties with regard to President Cyril Ramaphosa's announcement on Saturday evening. To discuss this, we're joined by political analyst Ralph Mathekga. Ralph, good to have you. Welcome.
Good morning, Leanne, and good morning to your viewers. Thanks for inviting me.
So I suppose it wasn't really a surprise on the announcement. It was just a matter of time as to when the president was going to say, South Africans, we're heading to level 2. What did you make of the address on Saturday?
It wasn't a surprise indeed. And looking at how South Africans have been behaving and how they've been showing irritations with stricter measures, people have been concerned also about the economy, Leanne. So for me, it's more like the president following South Africans to level 2 of the lockdown. So it was quite a reasonable step given the circumstances, and also looking at the plea by various groups that we cannot continue this way. We have to allow the economy to begin to function so people can fend for themselves. So it is a decision that has been dictated by circumstances, Leah.
It certainly has. I mean, we're looking at the numbers, and I'm not going to get into the health aspect with you because we have got a health expert coming up a little bit later on the program. But, you know, looking at the numbers, they were dropping. They are dropping. The infection rate is below 3,000 on some days. It was just becoming unsustainable in terms of a medical excuse to keep the country under lockdown and under level 3, and such a stringent one, that there almost was no option but for the president to open up.
I mean, Leanne, it's a question of common sense. You don't have to be an epidemiologist to know that the trajectory of the virus in South Africa is quite different. We are having relatively lower mortality rate compared to global average. When some countries had the level of infection that we are at, they were experiencing a lot of higher mortality, and we are not. And also, we are also seeing here a very good improvement when it comes to the recovery rate. So all of these things are actually raising question as to whether the stricter lockdown measures are still relevant in controlling the disease. And the answer is no. So you cannot just maintain strict lockdown measures while you are seeing that the country is responding much better in a way that allows you to adapt it better. But I also think, Leanne, there are some outstanding issues here. I mean, I don't know what is the use of the state of with the use of the curfew for. My sense is that the curfew is still in place, where the movement of people in terms of the curfew is still limited. But you ask yourself, is this still helpful in managing the spread of the disease? And can you still justify it as a necessary measure? It's going to be difficult. I think South Africans, credit goes to them as well, that South Africans have learned to adapt to live with this. I've seen people around, of course, and people have been speaking about how speedily people have learned to live with this by wearing masks and sticking to those health protocols. So if we have those that are working, Leanne, why are we maintaining things such as a curfew? I don't understand.
Yeah, indeed. Let's break it down slightly into some of the announcements that were made and the reasons behind this. So I want to start off with the tobacco industry. And since the very, very beginning of the lockdown, and that's from March, the sale of cigarettes has been illegal, although we have seen that it didn't stop the sale of cigarettes from happening, because we saw the illicit trade of cigarettes going through the roof. And of course, all of this industry that, you know, was always being fought against and trying to get under control was running rampant, and everybody was turning to those to buy it. Now, it took all these months. Now, this went to court. We saw a British American Tobacco South Africa. We saw the Fair Trade Independent Tobacco Association taking government to court, and we were going to see those taking place very, very soon, but government quickly intervening before that happened, because I think it would have been quite a bad position for government to be in, for them to win against government and perhaps start uncovering what was really happening behind the scenes. Maybe you can give us a little bit of what was going on with this tobacco banning.
I mean, Leanne, the tobacco banning, it has become one of the most source of contention. And I think the issue here is whether prohibition of smoking actually contribute to the fight against the virus. There is no evidence to that. And it appears that there was just more of a policy commitment than a commitment to a reasonable measure that is justified by the circumstances. Of course, the issue went to court, and now, as you and I are speaking, it appears as if the issue is going to become a moot case. But I have to say that is not going to be the case. I think that the case will continue. We know that one of the tobacco group had actually been granted leave to appeal at the Supreme Court of Appeal, where actually the cost relating to the previous case was even set aside at the High Court. So it actually says that this issue is going to be tested. Whether or not people are allowed to smoke today, we still have to get a sense when it comes to clarity about whether the smoking of alcohol had anything to do, or prohibition was a reasonable steps relevant to fighting the COVID-19. That is still to be determined. And Leon, the possibility is that if government lose these cases all the way, if the court decide they are going to continue hearing these cases, even if the alcohol ban has been lifted, it might result in the possibility of lawsuit against government. Remember, government is not entitled to arbitrary action. Its conduct should be justified, and this is what the court is going to determine.
Yeah. Ralph, I want to dwell a little bit more on the banning of tobacco. We'll get to alcohol shortly, but on this ban of tobacco, you see the industry coming out and saying that, and there is a bit of evidence that they've come through and said that during this entire time, the amount of money government would have made through excise and through taxing would have been the same amount as the loan that they took from the IMF. Now, in the back of our mind, let's remember that we were the only country in the world to have put a ban on tobacco products, and the illicit industry just went through the ceiling during this time. I mean, in excess of 600% is how much they grew, and the prices they were charging were ridiculous. Obviously, they're conspiracy theorists and talk behind the scenes of who was benefiting, and perhaps it was government filling their own pockets or role players in all of this. I mean, can we believe anything more than the fact that they really were trying to protect South Africans and their health, and it was a scientific decision?
Well, it was argued as a scientific decision, Leanne, but it came down faltering because the evidence that has been coming out there was that actually smokers are less likely to be infected. Of course, if the smokers were to be infected, it could turn horrible for them. But the reality, as the evidence has been coming out there, and this thing, Leanne, common sense. I mean, when government started taking a position on tobacco, they emphasized the scientific evidence, and it turned out there was just no scientific evidence on their corner to support their position. So what we have here is that we have had a policy that has been implemented in a manner that there was no way it was going to help government achieve its goals, namely the goals of actually making sure people do not smoke and the health system is alleviated. That has not been achieved because people kept on smoking. And as you correctly stated, we have actually built extraordinary capacity in the illegal contraband market. Remember, those who study illicit smuggling economy will tell you that the amount of capacity we have injected into the legal cigarette during the time that we have banned legal cigarette, we removed competitor, and the capacity that the illegal cigarette will be left with, it is going to have an impact on crime for years to come. So you cannot stand as government and say you have achieved. And my view here, Leon, is that the decision to lift the banning, it's a cut and run by government, because government cannot justify why it did that in the first place. Is one of the reasons that I think government has come out quite poor on.
Yeah, and that's a space we really need to watch, because that's not going away anytime soon, as you rightly mentioned. Alcohol. Indeed. Alcohol was banned because of, again, we talked to the scientific evidence that casualty wards were being filled up and there was no hospital beds, and so it was banned at first, then it became legal, and then it got banned again because of the pressure on the healthcare system. Ramaphosa said on Saturday night, all indications are that South Africa has reached the peak and moved beyond the infection point of the curve. So basically indicating that coronavirus cases are now on the downturn. But now with alcohol out and about again, let's talk about the challenges there.
Yeah, alcohol is the consumption of alcohol abuse. It's a social problem in the country. We know it. It's a long-standing social problem. We know it also contributes a great deal to gender-based violence. And I think that as much as we know that and as much as we want to deal with that, it makes no sense whatsoever to try to get the nation to avoid alcohol completely within the short space of time. And again, government offered its own justification why they are doing that. In most cases, you find that we don't really find data that is coming out. I mean, key decisions have been made, Leon, in relation to this lockdown. Very overreaching decision. And the sad part of that decision, or the part of the story that is said, the poor justification. I mean, people put together conjunctures such as people are going to drink a lot, end up in hospital, we are not going to fight the virus. For me, such level of poor reasoning is not enough to allow for government to excessively go into civil liberties and limit civil liberties. I'm not saying that alcohol is good, but I'm saying if you're going to remove civil liberties excessively in the manner that we have seen under the lockdown, at least provide solid reasoning. I have not seen that. I've just seen sometimes the minister will come and say that car accident have been reduced because of alcohol and so forth. A lot of things. I mean, the minute someone gets born, the chances of dying are just severe anyway. If we look at it from that point of view, Leon, we cannot just try to bring everything else as the cause of death. And I think we had almost done that. And people will be happy to get back alcohol. I think, however, they will be worried about how they're being treated by government, which is almost becoming a nanny state that just want to babysit its own citizen. That's just not in good spirit, in my view.
Yeah. I mean, let's look at some of the political parties' reaction to the move to level 2 and the announcement. I think we saw the Freedom Front Plus, the DA and the COPE kind of welcoming going to level 2. EFF again saying there's no scientific proof for us to go down to level 2. They're questioning it. And the PAC saying the announcement by the president to ease the lockdown does not give any confidence. So, you know, it's a difficult time for the ruling party, isn't it? And I think we need to dwell on that for a little bit, because we've seen anger coming in from South African citizens. And this has all got to do with the desperation that many find themselves in. They've been promised, many even a little, as much as 350 Rand, and many complaining that they did not even receive that. Some of the packages that were put in place to try and assist South Africans were never, ever received by South Africans. Then there was the talk of corruption, the talk of rampant job losses. I mean, we haven't seen the figures out yet, but talk of way over 50% of unemployment rate here in South Africa. This is a tough time for the ANC.
It is quite a tough time, Leon, and genuinely so, because the ANC has never been here. No one has ever been here before. We are all learning. We are adapting the system as we move with how to respond to this pandemic. However, there are certain things about us that we should not have allowed to creep into this, which is the mismanagement of the funds. Because if you are mismanaging the funds, people beginning to doubt other decisions that you are making in relation to the management of this COVID-19. I mean, government has been under pressure where parties such as the EFF have been saying that, look, government is being bullied by business which just want to open irrespective of the potential loss of life. And on the other hand, government has been lobbied by business which have been saying that you cannot continue living like this because the virus is not going to disappear. So all of this point to a delicate balance where you have to avoid the two extremes. One extreme is to shut down the country totally. It's not workable. And another extreme is to pretend as if we are back to normal. It's not going to work. So you have to stay in the middle, which is about adapting and balancing, which is, I don't agree with the EFF that we have to go back because we are not there yet at a zero infection rate. We have to go back to complete lockdown. I think that does not respond to our ability to adapt. I think we are becoming much more adaptable, and we are adapting. And Leanne, I know this sounds controversial. Sometimes I look at South Africa on how we have come out of this pandemic. We have come out better than projection. And sometimes I ask myself a question that I'll never get an answer. Have we done well because of government's intervention or despite government's intervention? I don't know.
Yeah. I mean, if we even look at the the president. I mean, let's talk to his performance over this time. We saw him in March. We've seen obviously a lot of countries around the world and their political structures being questioned by the people. And I mean, this is a pandemic that, as you say, we could never have predicted it. And governments have been exposed in every possible way during this time. Not only here in South Africa, some have come out right on top, and others have come out right at the bottom. How do you think our president has performed during this time?
You know, in greater scheme of things, doing a global comparison, I would say that the COVID-19 found many administrations actually struggling, and it actually leaves two options for most administrations across the world. You are either coming out of this with greater success, or you're coming out being an ultimate failure. There is no middle ground. And when I'm looking at President Ramaphosa, he's treading this non-existent middle ground. He's managing a crisis in the middle of politics that is almost dysfunctional with corruption and so forth. So in the greater scheme of things, he's holding up well. But I think he could do much, much better. It's just that the circumstances they just don't favor any kind of a rapid, swift action on this. Our politics, it was found dysfunctional, Leanne, and there was no way that it could have been rescued quickly in time to do well in our response to COVID-19.
Yeah, I mean, just final question to you, Ralph. We obviously may see, I say may because there is talk of possible postponement in the elections next year, and you know that's all to be seen. But if we look at the ANC and their strength right now, because as I mentioned earlier, there's a lot of anger amongst South Africans, and particularly when it comes to the PPE and all of the corruption that's happening behind the scene. And also, I mean, you see somebody like Ace Magashule coming through and saying that, defending ANC officials being involved in business and saying that there's nothing wrong, even his family being highlighted in all of this. And that's just one leader I'm talking to. What is the strength of the ANC at this time?
It's very clear, Leanne. The pandemic, it's an unknown phenomenon, dangerous for the people. But I also think that the ANC is the weakest link in South Africa's response to this pandemic. I mean, the party is not well positioned. The party is ambivalent towards corruption. And I think that at this point in time, the party has not taken a strong voice to say we are not a conduit for corruption. They are not saying that. And it's quite a concern that it is failing to say that in a moment like this.
All right, Ralph Mathekga, always a pleasure speaking to you. Thanks so much for your views here on the program. Ralph is a political analyst talking to us about the lockdown level 2 that we are going to be moving to at midnight this evening, and also the reaction from our president from the beginning to the lockdown and the coronavirus, as well as the ruling party and many other issues with regard to tobacco and alcohol. But right now, let's get you the top